Arthritis means joint inflammation, but the term is used to describe around 200 conditions that affect joints, the tissues that surround the joint, and other connective tissue. It is a rheumatic condition. The most common form of arthritis is osteoarthritis. Other common rheumatic conditions related to arthritis include gout, fibromyalgia, and rheumatoid arthritis. Rheumatic conditions tend to involve pain, aching, stiffness, and swelling in and around one or more joints. The symptoms can develop gradually or suddenly. Certain rheumatic conditions can also involve the immune system and various internal organs of the body. Some forms of arthritis, such as rheumatoid arthritis and lupus, can affect multiple organs and cause widespread symptoms. Fast facts on arthritis. Here are some key points about arthritis. Arthritis refers to around 200 rheumatic diseases and conditions that affect joints, including lupus and rheumatoid arthritis. It can cause a range of symptoms and impair a person's ability to perform everyday tasks. Physical activity has a positive effect on arthritis and can improve pain, function, and mental health. Factors in the development of arthritis include injury, abnormal metabolism, genetic makeup, infections, and immune system dysfunction. Treatment aims to control pain, minimize joint damage, and improve or maintain quality of life. It involves medications, physical therapies, and patient education and support. Consume plenty of beta-carotene from yellow and orange vegetables. The following foods are rich in beta-carotene: apricots, asparagus, broccoli, carrots, Chinese cabbage, chives, dandelion leaves, grapefruit, herbs and spices, chili powder, oregano, paprika, parsley, kale, ketchup, many margarines, onions, peas, peppers, plums, pumpkin, spinach, squash, sweet potatoes. Consume food that has major B vitamins and niacin. Whole grains, dried beans, legumes such as split peas and lentils, barley, buckwheat. For more such videos, follow the channel and subscribe.